So we are going to take a moment to access a portacath here on our patient. Obviously, if we came in the room, patient privacy, name, date of birth, assessing, making sure he doesn't have any latex allergies, introducing myself, making sure I do have an order from the physician to access the port, and gathering all of my supplies. I brought a couple of extra masks for myself and for the patient. My kit will also come with one, but if there was anybody else in the room that was assisting me, they would wear a mask as well. We're just trying our best to maintain as much sterility as possible. Looking at him, I'm going to see that his port here is on the left-hand side, so I'm going to have him turn away from the port. We don't want him breathing down on it. I've done my hand hygiene. I'm going to go ahead and just really quickly put a mask on him. I don't think it's actually going to stay on this mannequin. That's okay. So we will just pretend he's got his mask on. Yeah, set that down. I will put my mask on. Few things I really like to point out. You're going to find a lot of videos online. You know, it's really important that you have a sterile normal saline. Some kits come with them. Most places do not have sterile flushes easily accessible. So we kind of have to just do our best at trying to maintain sterility the best we can. I need my needleless connector that will go to my Huber needle. And I've got my Huber needle here, my flushes, and my kit. So I'm going to make sure I've got everything there. What I'm going to do, and you can do this a few different ways, I'm going to do my absolute best to try to maintain the sterility here. But I also know I am going to have to flush my Huber needle before I access my port, right? A couple of different ways I can do this. Knowing I'm going to just, maybe not necessarily perfect, but I'm going to try. So my kit here comes in a box. I'm going to set these out really quick. I've already put on a mask, but if I needed one, I do have this one here. Okay, I'm just going to set this to the side, throw it away. I don't really need it. All right, I personally like to open my Huber needle and place it down in my kit. And then I also like to open my port here. I'm going to go ahead got my saline set up to the best of my ability. Okay, set that to the side. So at this point, I do have to remember I have to flush my port before I go to access, but I also need to clean. And to be able to reach into my kit and get my supplies, I need to have my gloves on here. I'm going to set this out of the way right now while I put on my gloves. I had any rings that had like sharp prongs or anything like that, I would remove those. Okay. I'm gonna reach in here on my sterile edges here. Throw that in the trash. Can't move this box back over here, but just using the inside. Okay, so some kits come with drapes that are really nice. You know, you could play that over the patient, down beside it, you know, all nice options. But for us, that's okay. We are just gonna work with what we got here. I'm gonna pop this. I don't wanna pop this over my field. Granted, this is a plastic container, so that helps. But if you have any paper field drape, you don't want to get it wet because then that gets rid of the sterility. So I'm going to clean, going in a hashtag type motion here for 30 seconds. Make sure that is nice and clean. And I would allow that to air dry. So I'm at a point where I will now be getting ready to access. This is gonna become my non-sterile hand. So again, I don't like that I have to do this, but in this situation, this is the best I can do since I know this is gonna become my non-sterile hand. I'm not gonna touch it with my sterile hand, but I am going to go ahead attach that, take my cap off there, prime, leave that connected. And I see where my 3 prongs are, just stabilize the skin and go straight in at a 90 degree, okay? So that should sit flush then with the skin, okay? My clamps are undone, so I pull back, checking for blood return, and then flush, making sure it flushes without difficulty. It's flushing, good blood return, okay. I do want to utilize the skin prep. If that's flush with the skin, I don't really necessarily have to slide this under, but I could just kind of protect the edges here. Just going like this. And then that's just going to help kind of protect the skin there. And then I can also just put a 2x over it if I need to, just as a cushion. And then this is just going to be where, so it's not up around the edges, but this skin protectant would be where I would actually be having the Tegaderm stick to the skin. So I still want to keep my Tegaderm sterile, not touching the inside portion that would be covering my needle. takes a while for this to actually dry on the mannequin. So, you know, with an actual person, we would allow that to fully dry. And then place our Tegaderm here. I would date, time, initial my dressing here. Clamp. I don't have any in here, but I would grab a Curo's cap. Cap the end of that. Secure my cord there out of the way. All right, now that dressing would be good for 7 days unless it becomes soiled or loose or anything like that.